Diabetes mellitus is a common endocrine disorder that nurses encounter frequently in all healthcare settings. It's a chronic condition affecting how the body regulates blood glucose, leading to various health complications if not managed properly. Due to its prevalence and the complexity of care it demands, diabetes is a high-yield topic on the NCLEX-RN examination. Understanding the pathophysiology of diabetes, recognizing potential complications, and knowing appropriate nursing interventions are crucial for safe and effective patient care. We'll cover recognizing complications, appropriate interventions, patient education, and prioritizing care. By the end of this video, you'll be well equipped to tackle diabetes-related questions on your NCLEX exam with confidence. Welcome, nurse. I am Miriam. Hypoglycemia or low blood sugar is a common and dangerous complication of diabetes treatment. It occurs when blood glucose levels drop below 70 milligrams per deciliter. Early signs include shakiness, sweating, palpitations, anxiety, and hunger. Severe hypoglycemia can lead to seizures, coma, and death. Offer 15 grams of fast-acting carbohydrate if the patient is conscious. Recheck blood glucose in 15 minutes. Administer glucagon if the patient is unconscious. Monitor the patient closely and be ready for further interventions. Diabetic ketoacidosis, DKA, and hyperosmolar hyperglycemic state, HHS, are serious diabetes complications requiring prompt attention. Both involve severe hyperglycemia but differ in mechanisms and presentations. DKA is common in type 1 diabetes, producing ketones and causing acidosis. HHS occurs in type 2 diabetes, marked by high glucose and dehydration. Treatment includes fluids, insulin, and electrolytes. Recognizing DKA and HHS differences is crucial for management. Insulin is a hormone that regulates blood glucose levels by allowing glucose to enter cells for energy. In individuals with diabetes, the body either doesn't produce enough insulin, as in type 1 diabetes, or doesn't use insulin effectively, as in type 2 diabetes. Insulin therapy is essential for managing blood glucose levels and preventing complications in many individuals with diabetes. There are several types of insulin, each with a different onset, peak, and duration of action. Understanding these characteristics is vital for determining the appropriate insulin regimen for each patient and preventing hypoglycemia. The choice of insulin and timing of administration depend on factors such as the patient's individual needs, lifestyle, and blood glucose targets. Section 5. Safe insulin administration tips for nurses. Administering insulin safely and effectively is crucial for achieving glycemic control and preventing complications. Here are some essential tips for nurses to ensure safe insulin administration. Always double-check insulin orders. Verify the type, dose, route, and time of administration with the physician's orders. Use the correct syringe and needle size. Rotate injection sites within the same anatomical area to prevent lipohypertrophy. Administer insulin at room temperature to avoid discomfort. Be vigilant for signs and symptoms of hypoglycemia, especially during peak insulin action times. Teach patients how to properly prepare, administer, and store their insulin. Section 6. Empowering patients. Diabetes Education Essentials. Patient education is a cornerstone of diabetes management. Empowering patients with knowledge and skills is essential for optimal health outcomes. Diabetes education should be individualized, culturally sensitive, and ongoing. Key topics include understanding diabetes basics, blood glucose monitoring, medications, healthy eating, physical activity, sick day management, foot care, and psychosocial support. Comprehensive education empowers patients to manage their diabetes and prevent complications. Section 7. Test your knowledge. NCLEX practice questions. Let's test your knowledge with some NCLEX-style practice questions. Question 1. A nurse is caring for a patient with type 1 diabetes on insulin therapy. The patient feels shaky, lightheaded, and sweaty. What should the nurse do first? A. Check the patient's blood glucose level. B. Administer a fast-acting carbohydrate. C. Stop the insulin pump. D. Notify the healthcare provider. The correct answer is A. Check the patient's blood glucose level. The patient shows hypoglycemia symptoms, so the nurse must confirm with a blood glucose check. Once confirmed, administer a fast-acting carbohydrate and notify the healthcare provider. Section 8. Conquering the NCLEX final thoughts on diabetes care. Diabetes is a complex chronic condition that requires comprehensive and compassionate care. As a future nurse, you play a crucial role in helping patients manage their diabetes effectively and live healthy lives. By mastering the information presented in this essay, you'll be well prepared to answer NCLEX-style questions related to diabetes with confidence. Remember to focus on early recognition and intervention, patient-centered care, interprofessional collaboration, continuous learning. By embracing these principles, you'll be well equipped to provide exceptional care to patients with diabetes and excel on your NCLEX exam. Good luck! Please subscribe to our channel for more exam resources. Download your free ultimate NCLEX guide from nursecareerblueprint.com.